Chapter 7, Documentation of Nursing Care. We will identify 3 purposes of documentation, correlate the nursing process with the process of documentation, discuss maintaining confidentiality and privacy of paper or electronic medical records, and compare and contrast the 5 main methods of written documentation. In clinical practice, we'll correctly make entries on a daily care flow sheet. Each person who provides care for a patient adds written documentation to the medical chart. Insurers rely on documentation to determine actual length of stay, procedures performed, and diagnosis established, and to calculate charges due for reimbursement. Charts are also used for research data collection. Documentation is also called charting, and it's used to track application of the nursing process. Documentation is also used for supervisory purposes to determine how staff members and staff nurses are performing. Standard areas of assessment are usually noted on flow sheets, and written note is added if an abnormality exists. Evaluation data must be documented showing that expected outcomes have been achieved before a nursing diagnosis is marked resolved or deleted from the nursing care plan. Each type of healthcare facility has a particular set of forms used to record information about patient care. The medical record is a legal record and its contents must be confidential. The medical record can only be given out with the patient's written consent. Whatever the method used, the nurse is required to chart the patient's progress periodically during the shift, as defined by the organization. Chart entries are either in notes or in various flow sheets, which track routine assessments, treatments, and frequently given care. Narrative notes are phrases and sentences written without any standardized structure, content, or form in chronological order, similar to a set of journal entries. Assessments usually follow a body system format. Because source-oriented charting encourages documentation of both normal and abnormal findings, it can be difficult to separate pertinent from irrelevant information. Source-oriented charting is time-consuming. Entries are lengthy, which discourages a thorough reading. Here is an example of the narrative charting. Once again, take note that we always put the date in a column. We are going to put the time. The time needs to be in military time. And then the other thing I want to note is that we don't write in full sentences and regular English normal sentences. We just state the facts, and when we sign our notes, we always put a line at the end of our last statement, and then we're going to sign it with our name and our credentials. Remember, you want to protect your notes. Problem-oriented charting emphasizes the problem-solving approach to patient care and provides a method for communicating what, when, and how things are to be done in order to meet the needs of the patient. It focuses on what, when, and how things are to be done to meet our patient's needs. Problem-oriented charting requires constant evaluation and revision of the care plan. It reinforces the application of the nursing process. This type of charting hampers putting the pieces of the patient situation together, and it also restricts us from seeing trends. Pie charting. The problems, teaching, and discharge needs are listed under the pie, or under the P in the pie. Interventions performed are documented under the I, and the outcomes of the interventions are evaluated and documented under the E. And here is an example of the pie format. Question number 1. Monica, a nurse in the operating room, knows that charting must be all of the following except number 1, subjective, 2, accurate, 3, brief, or 4, complete. Answer is number 1. Charting should be specific and definite. It should be in objective terms only and should not use subjective terms or phrases like quote unquote appears to be restless. Second section of Chapter 7, we're going to compare and contrast the 5 main methods of written documentation. List the legal guidelines for recording on medical records. Relate the approved way to correct entries in medical records that were made in error. In clinical practice, we'll demonstrate a systematic way of documenting that ensures all pertinent information has been included. Document the characterization of signs or symptoms in a sample documentation situation. Apply the general documentation guidelines in a clinical setting. Navigate electronic medical records and document care correctly. Focus charting is similar to the problem-oriented, but it substitutes focus for the problem, eliminating the negative connotation attached with problem. And it has 3 components: data action response or data action evaluation. It also has advantages and disadvantages. Advantages are it's, again, compatible with the nursing process. It shortens charting time. Disadvantages, if the database is insufficient, we could miss patient problems. And it doesn't adhere to charting with the focus on nursing diagnoses and expected outcomes. Here's an example of focus charting. The standards and protocols are integrated into flow sheets and forms with charting by exception. The nurse needs only to document abnormal findings or responses correlated with the nursing diagnoses listed on the nursing care plan. The problem with charting by exception is that we are assuming that unless documented to the contrary, all standards and protocols were followed and all assessment values were within the accepted limits. This type of documentation may present some problems with legalities when a medical record is called into court because only abnormalities are documented in written words. This type of charting may present problems when a chart is called into court, again, because of the abnormalities, because only the abnormalities are charted or documented in writing. The EHR or the EMR type of record, that is the goal of the future. You know, systems are under design and study to accomplish this goal. Security and confidentiality of records is still a concern because of the potential for a breach. This method is very cost effective in terms of nursing time because the information is entered from the patient's room, so no time needed to be spent later down the line to try to recall important details. Some systems allow clinicians to select data from display screens to build the flow sheets and the progress notes. Electronic records can be retrieved very quickly. That's an advantage. We can provide a complete record of the patient's medical history, and it's very important that security is maintained. Disadvantage: computer downtime can create problems of input, access, and transfer of information. Documentation of variances is placed on the back of the pathway sheets, and care planning or case management system charting is just a little bit different. It is also an interdisciplinary type of documentation or charting that that you will see no matter where you work. There are case management teams in place. Specific data about size, amounts, and other measurements provide a means for determining whether the condition is getting better, getting worse, or staying the same. Each agency also has its own list of acceptable abbreviations and symbols. This list is usually found in the Policy and Procedures Manual. In most agencies, if data is recorded on a flow sheet, they need not be documented again in the nurse's notes. So a good example of that is if we are completing our physical assessment, we usually have a flow sheet or a separate place that we put in our EMR systems for our assessment. We're not going to type out a full progress note or a nurse's note with our full assessment. There's two different places in the chart for that sort of documentation. A rule of thumb is that if the behavior or finding is abnormal or a change from previous behavior or data, you want to chart about it. What constitutes complete charting may vary among hospitals, extended care facilities, and other healthcare agencies. What is particularly important to document in home care is you have to note the safety factors in place and that are needed for continued care. Those are things that you need to document, that you observe, and that you put into place. You want to record information about the patient's needs and problems and specify nursing care given for those needs and problems. Again, I want to refer you guys to your book in boxes 7-1 through 7-3 for documentation guidelines. Question number 2. Madison, a pediatric nurse, prefers charting by exception. She realizes all of the following are true except number 1. Charting by exception was developed in 2005 by a group of nurses at St. Luke Medical Center in Sarasota, Florida. 2. The goal is to decrease the lengthy narrative entries of traditional systems. 3. Charting by exception is based on the assumption that all standards of practices are carried out. And or 4. A longhand note is written only when the standardized statement on the form is not met. The answer here is number 1. Charting by exception was developed actually in the early 1970s by a group of nurses in Milwaukee, Wisconsin. Question number 3. Mrs. Smith, an LPN, has just charted the following assessment on her patient. You guys can read the note there. Which of the following entries is correct? Number 1, time of entry. Number 2, nurse stating an opinion. 3, no line before her name. Or 4, all of the above. And I don't like this question because it doesn't appear that there's any room for you to put a line before her name, but the answer is number 4. The time of the entry should be in military time. The nurse stating an opinion by stating appears, quote unquote, tired. Charting should be based on facts, not opinions. There should be a line from the last word to the nurse's name. Question number 4. Sally went into her patient's room to administer an antibiotic. Her patient states, "I'm not going to take another pill because they aren't working." What should Sally do? Number 1, leave leave the pill on the bedside table and come back in a few minutes. Number 2, throw the pill in the trash can. Number 3, circle the medication on the medication record, give a reason for the refusal in the progress notes, and notify the physician. Or number 4, crush up the medication in the patient's food and inform the charge nurse. The answer is definitely number 3. A nurse must record on the medication record and give an explanation for the refusal in the notes. Never leave a pill on the bedside table. Don't ever throw a pill in the trash can, and do not ever crush the pill and give it to a patient without their permission.